The whole purpose of FIT, that is feedback-informed treatment, is knowing whether the work you're doing is engaging your client and effective. To that end, the ORS and SRS, the outcome rating scale administered at the beginning and the session rating scale administered at the end, can help you quickly identify those clients that are at risk for dropping out or a negative or null outcome from treatment. The benefit of FIT doesn't stop there because it also offers a process once you identify a client is at risk for what to do next. Now, it's not a way of doing treatment. Recall, FIT is agnostic as regards the treatment method that you happen to use. Rather, it's a way of ensuring that however you work, whatever your theoretical orientation and preferences, that it is fitting with and empowering the most robust predictor of treatment outcome, the therapeutic relationship. That leads me to today's FIT tip. If you have been around the FIT community for a while, you've likely heard of what's been called the FIT Alliance stool. Going around the various parts of that stool can help you identify if and where adjustments need to be made in your understanding of the relationship in order to improve client engagement. What are those parts of the stool? The 3 legs include, with the leg furthest to the left, what is it that the client actually wants? Moving over to the right, what are the means or methods that would work for them? At the top, client preferences. How do they want to be viewed by us? What's their identity, their background, their core values, and does treatment fit with those? And the middlemost leg is the role you assume. Are you providing the core conditions in a way that are felt by the client? Empathy, respect, and genuineness. And are you in the role that they want you to assume in the helping process? Said more succinctly, what is it the client wants? In what way? Consistent with their core values and identity, and what's the role they want you to assume? In practice, that means beginning with the leftmost leg. What is it that the client wants from you? And be careful, because quite often we therapists equate the client's problem or diagnosis with their goals for care. In my consultations with therapists and agencies, 7 times out of 10, discussing what the client wants helps the therapist feel confident about the steps they need to take next, either recognizing what they may have misunderstood or going back in the room to clarify what it is that the client might want from the service. Of course, that leaves 3 out of 10 times when one of the other 3 dimensions in the alliance stool provide a key to helping the therapist know how to go back and work more effectively with the client. It might be about how they are working together, making a better fit with the client's values, preferences, and identity, or recognizing that what the client wants the therapist to do, the role they want them to assume, is different from what the therapist has assumed in the room. Either way, working the FIT Alliance stool, it's most useful within the first 10 to 12 visits. Beyond that, it's very likely that to improve engagement and outcome, the therapist will have to take additional steps, changing the where of the therapy and perhaps even changing who is providing the therapy.